Hello, hello, everyone, and welcome to the December edition of our traditional webinar, Ask Julie Anything. I am Mariana Nadai, and I will be your host today. And today is the final AJA of the year, and during this session, our co-owner and formulator, Julianne Lee, will answer all your questions about your beloved fur friend. So, you know how it works. Don't be shy and ask Julie anything. Before we start, though, I want to remind you about some housekeeping rules. Please switch your chat to everyone so we can all join in the conversations. Use the Q&A box below to ask your questions. We will answer them in order on a first come, first served basis, and we will do our best to answer all of them tonight. And we also have another request. Please limit your questions to just one so we can answer as many as possible and help as many people as possible too. We are doing our best and we count on your cooperation. Thank you so much. And the most important thing of all, this session provides a judgment-free space with only the health and happiness of our animals and the planet being our core goal. So without further ado, I want to call you, Julianne Lee. The floor is all yours. Hi.
Hello, everybody. So I guess in a way we should just like jump into questions. I can't believe this is the last of the 2024. That's
I can't
crazy.
believe either. Like it's
Crazy, crazy, crazy. Um, I guess do you want to, wow, there's already 10. Okay, why don't we
okay.
just start? Why don't we just jump in?
I'll start here. Korth family. 2 healthy adult dogs on balanced raw food and supplements, but after they eat pork loin, their bodies have intense histamine reaction lasting 10 to 10 days, 7 to 10 days. Right
Yeah.
foot on the catahula,
Catahoula.
right inner thing on the
Hi. On a
thigh.
Visa. They're breeds.
Positive immunity helps this recovery as well as nettle tea and topical ointments. Question: regardless of the source of the pork, Walmart, local country store, online shipments, these reactions occurs. What is happening?
Well, I don't know. I mean, if it was just one dog, I would be saying that they have a food reaction to pork. The only thing I can the only thing I can think of is that um I don't know if they have something like leaky gut, let's just say, if they have that and you were feeding a food that had some kind of pork in it. Do you know what I mean? Like a pork protein that maybe you didn't know, or like a different kind of food that had pork in it, then they can both have um had that antibody or antigen move into that protein into the bloodstream, and it would create a reactivity or a sensitivity. So I don't know whether or not you remember feeding anything with pork in it or not before, because it's very interesting that they're both doing it, right? Like if just one was doing it, then I'd be, well, clearly it's having a food sensitivity, a protein sensitivity to pork. But because they're both doing it, I'm just wondering, were you feeding at any point um, pork in like a dry dog food before they were on raw, or if they've been on raw um, for a long time? That's the only thing that's really the only thing that I can think of where they would be reacting that way. Like it's interesting. Unless you've always fed, unless it's really hard without asking questions, but let's say you've always been feeding a beef, and you've never fed anything but beef, and then you feed pork, and then they're sensitive to pork. I mean, that maybe you're doing all different proteins and it's just the pork they're sensitive to. it's very hard for me to say, but if both dogs are reacting, I would say both dogs have had at some point in their life had pork, and at the time of having pork, they've had leaky gut, right? The protein has gone through the mucosal lining into the bloodstream, and they've reacted to it. So I don't know whether she can put something in the questions, whether, has she ever done that? And then we can go back to that question, Mariana. Maybe she can put it even in the chat and someone can read it. But my biggest question is that did at some point have they ever had a dry food or a food before that had pork in it? Maybe prior to putting them on raw, unless they've been on raw the whole time. What are you doing?
Yeah, they had kibble for many years.
Kibble.
Yeah.
And she doesn't know so what could have happened, or what potentially could be happening is that maybe one of those kibbles had pork, right? And they were feeding that kibble for long periods of time. That pork could have been with something else in that dog food that created the trauma in the gut lining. And then at that point, that particular protein seeped in through into the bloodstream. So now they're both reactive to pork. That's the only thing I can think of. So I wouldn't feed pork. Like I just wouldn't I would work on both of their guts very, very strongly, making sure that the mucosal lining is really healthy. Have them maybe off of don't feed pork maybe for 6 months. Really work on their gut health. And then you could potentially try the pork again. But I would make sure that the pork that you're getting is pork from, like a local farmer or free range pork. Because the other thing that can happen if the pork is coming from a high stressed pig farm, and pig farms can be incredibly high stressed, it could just have a ton of cortisol in it. Like just all the pork that you're purchasing maybe has a lot of cortisol in it, and maybe both the dogs are sensitive to that.
What do you
Oh,
think?
okay. Okay, next.
Just a second. I'm trying to find here the Q&A. It got lost. Okay, here. I'm back. Hi, Julie. Amanda Crooks. I have been trying to navigate both of my dog's allergies and gut health for over a year. I'm slowly seeing progress since using some of your products. Yeast, leak gut, soy C, and potency. Both of my dogs have watery, itchy eyes intermittently. They rub their face on the couch or paw at their eyes and chin. I'm not sure whether they have seasonal, environmental, or food allergies. I have done all the testing and all the protocols, but there is never any consistency with their scratching and licking. I wonder if the itch, watery eyes could help diagnose which kind of allergy would be likely. Unfortunately, I can't get the colostrum in Canada, so I have the positive immunity in Canada. So I have another brand I'm going to use, but not sure if I can use it while doing the protocols.
Mm-hmm. Well, the only downsides of using another colostrum is that it just makes sure that well, if they have a beef allergy, even with ours, right? You have to be careful if they're sensitive to beef, like really, really sensitive. The watery eyes, that's often, I'm not going to say for sure, that's often environmental. But the itchy mouth, I find that happens a lot if they're eating something that they're sensitive to, and then they'll rub their mouth. In both cases, it's very, very histamine-ish, So I would say, again, I wish that there was some type answer. Oh, I can't type answer. Can she type back if I type the answer? Maybe? I don't know. So my question is, have you used a journal to write down what protein you're feeding or what you're feeding? And if the itchiness and the watery eyes are better, same, or worse. So that's the first thing that I would do. Make sure that you're not using some kind of like fabric softener, any kind of like scented candles, anything with that affects the hormone levels. Uh, that would be something that I would be looking at because when they're when they're on the floor, on the uh, rugs or something like that, then you can definitely get that kind of a reaction. Same with bowls. If you're not using like a pure glass bowl or a pure stainless steel bowl or oh, what's it called? It's there's a company called Food Platter, and that's a really good type of plastic bowl. But you have to be careful with bowls too, because that can cause the mouth and even the eyes, because the eyes are so close to it when they're eating. So I'd look at bowls. But if they're getting better, slowly getting better, then you know what I would do, and if you've been doing it for a year, I would start to rotate the soil and sea with the wolf. So do soil and sea, and then stop it when you're finished, and then go on to the wolf, then stop it when you're finished, and then you could even go on to phytophthora. And then once phytophthora is done, go back on to soil and sea. So you could rotate the probiotics to see if there is a particular bacteria that your dog is needing. Because if you rotate through them, you're getting a really diverse, all different kinds of bacterias. I would try that as well. But don't try anything, don't change anything when you're using the new colostrum, because if you change from soil and sea to wolf, or you change from soil and sea to a different probiotic, then you start the colostrum at the same time and they get worse or better, you're not going to know whether it's the colostrum or the change, and then you're going to be wasting money and time. So try one thing first. So I would do the colostrum for at least a month to 6 weeks. See how it goes. If there's not like a huge change, then once you're finished the soil and sea, then go right on to like the wolf. And once you're finished the wolf, go on to phytophthora. Once you're finished phytophthora, go back to soil and sea, and then the wolf. So I would change them around. The other thing that I was just going to say quickly, you were on, you're using yeasty beast and leaky gut. So the liquids in that, the homeopathic liquids in yeasty beast and the homeopathic liquids in the leaky gut, they can be incredible. So I'm wondering whether I don't know if you've finished using those or not, but you can try giving them more often. When you see them, if they're really itchy, you can try giving them more often. Like, don't stop after the 2 weeks. Finish, like maybe do it for a month. The homeopathics, you can try that as well. Kathy, is that her? No. Oh, it's from Kathy. Never mind.
So the next question is from Corthy family. Again, I guess I'm jumping it just because.
I'm holistic treating canine cancer and covering all bases using positive CBD blends. Gussie's gut.
Or do you want to?
Just read it. It's fine.
Because do you want me to read it?
Just quickly read it. Yeah. I mean, we're there where everyone's looking at it anyway. So
I am holistically treating canine cancer and covering all bases using positive immunity plus CBD blends, Gussie's gut, turmeric, etc., along with balanced raw food. Question: I want to add artemisinin, wormwood, but the research says when it comes into contact with high iron, the molecule is unstable, resulting in cancer cell death. Would the bovine plasma interfere with any of this process? The
Potentially,
positivity.
potentially, but then so will your food. So will anything that's like so will certain meats and stuff too. So, I mean, you can use that. I've used it. I have used it before in my practice. But if you're concerned about having any kind of reaction with that, don't be concerned and start using chaga and turkey tail in like really in high doses. That's to me that is like the most because I have used I'm not telling you not to use artemisian because people have had success with it, but it is a lot more fragile to use that. Like there are more side effects and there's definitely some concerns with contraindications using it with certain things. So, for me, like with my cancer research, I'll be doing something in January for you guys on that. But mushrooms were my go-to in practice along with homeopathy for cancer. So that's what I would suggest. Or find a holistic vet that can, really work with you with that. That would be helpful too.
Thanks. Laura is asking, what are your recommendations for treatment of lip fold dermatitis? And if a dog eats a raw low-carb diet, are there some routine blood work values that may be different from a kibble-fed dog that may be of concern to some veterinarians? And should I be concerned?
Okay. Lip fold dermatitis. Lip-fold dermatitis can be very similar to the first thing that people were talking about where they're itching their faces and their mouths. So any kind of dermatitis or any kind of again, look at your bowls, make sure that your bowls are what you need to be using. Make sure that they're not licking anything or touching anything with their mouth on a couch or something where they're reacting to fabric softeners, things like that. So, um, uh, and so just be very careful of contact because when it comes to lip fold stuff, a lot of times it can be contact. Plastics, chew toys that are not, that have different kinds of, uh, fire retardants in the synthetic materials of the toys. That can be very, very aggravating to the folds of the lips. Um, I would probably just either, do something like the leaky gut protocol or start them on really high SODs, uh, phytosynergy, a turkey, like maybe phytosynergy, turkey tail, and the wolf. Those three things you could try. And what I would try if you haven't tried it is the rebalancer. The thuya and silica can be really helpful for that. But again, I can't recommend to you guys strongly enough to keep a journal. Journals are like I said, I think I've said this before in these things at my vet hospital. Every single new patient went home with an Adored Beast journal. He had hundreds and hundreds of them, and people would just go home, and it was just a journal, and they tracked, new food, new fabric softeners, started a daycare today. Oh, seems like every single time he goes to daycare, he gets itchy or he gets diarrhea or whatever. Journals are amazing. They're life saving when you're trying to sort out stuff like allergies.
There's this
Oh
other,
yeah, and if a dog eats a raw, low carb diet,
are there
yes, there
some
is.
routine?
There is. So proteins, high proteins, sometimes the pancreatic enzymes can be elevated. But it's mostly kidney like protein values, like what I've seen, protein values in pancreatic enzymes. And no, if your dog isn't showing symptom, I mean, if it's crazy high, 100% you should be concerned. But if it's just mildly elevated, and the best thing to do with something like that is just get blood work every 3 months. So get blood work every 3 months and see if the elevations stay the same. If they stay the same, then it's probably the diet and it's fine. But if it's if it's going up and down or if it continues to go up, then yeah, then there's maybe something else going on.
Great, thank you. Bailey Watson is asking, my dog has a fractured toe. Do you have any supplements that could help heal bones and a potential soft tissue issue? Anything that can help, even other
Yes.
treatments.
Yes. So I'm just laughing because I actually fractured my toe. I can't remember when that was, like maybe, I don't know, a year ago. But our jump for joints is incredible for hairline fractures or fractures where they don't do surgery or they don't cast and things like that, like toes. Uh, it's amazing because it has knit bone in it. It's also got homeopathics that help to heal the periosteum of the bone. And that's a lot of times when people and animals have arthritis, any kind of bone issues of any kind, then what really is needed is that the periosteum is fed and has good blood flow so that it can feed the bone properly so that it can heal, including the periosteum even of ligaments and soft tissue and things like that. So I would say jump for joints, and you could give it to your dog 4 times a day for, the first month, even 4 times a day for the first month, and then, twice a day, maybe for another month, and then once a day for a month after that, and just see how it's healing. Um, yeah, I've used that lots and lots and lots of times with fractures, all different kinds of fractures in like, hairline fractures with horses, all kinds of different stuff. Oh, I had a chicken with a broken toe. That's what we did with her. Or even bone injuries, right? Where they really bang the bone and then the periosteum actually becomes bruised. It can be more painful actually than a break. So I would do that. The other nice thing is red light therapy is really, really great for that. So I actually have it's called Kyla, Kayla, I think. And it's incredible. So and it's not very expensive. I always like, you can buy it and use it on your own animals. I use it on my horses. I use it on the small animals I've used it on chickens, ducks, I mean everything. And that's the one I forgot in Moncton, and you went and got it for me. So it's just a little box. It's fairly expensive, but relative to what it does, it's phenomenal. Like I use it every time I hurt myself, which is every day. Almost. I'm always getting banged around by my horses, or like it's so slippery now. I think I've fallen like 6 times on the driveway. Um, I always use it, and I can instantly feel the difference when I use it. So that would be helpful too.
Amazing, thank you. So Nancy, her question, it starts here, but then she finished a little further, but I'm starting here. I have the full question. I copied and pasted for myself. So my 6-year-old spayed female Boston Terrier had a 3-root molar with a slab fracture and growth removed last Wednesday, December 4th. Full mouth dental radiographies revealed apical pathology and some bone loss associated with the mass at 108. The abnormal gingiva was excised and submitted for histopathology. The tooth was chirurgically extracted. Pathology revealed focal fibrous hyperplasia.
Yeah.
So, and
Yeah.
she's taking some medications,
Yeah,
clean
clindamycin and gabapentin.
and oral metacam.
Oral
also.
Medicam, is that down farther?
Yes, it's down further. So her question is,
That's it, oral medic. Okay, yeah.
I have all your supplements and probiotics. What do you recommend to clearing her system of antibiotics and anesthesia? I also have rebalancer. Would that help? She also takes
Desiccated
desiccated
thyroid.
thyroid for low thyroid.
Yeah. So instantly liver tonic would be like the number one thing that I would say. And then I would recommend going to a health food store and purchasing a 30C phosphorus and a 30C Nux vomica and giving her that once a day for about a week. They're not expensive. They're like $8 for a tube and there's like 80 pills and you just give her four. So you would have lots left. So I would do that. That really helps to clear the kidneys and the liver from the anesthetic. And oral Medicam is very hard on the liver. Yeah, I mean drugs in general, the anesthetic, everything. So I would do that and get the liver tonic. And then so when I read um what they're saying that I'm just going up again, sorry, just real fast. There we go. Fibrous hyperplasia. So, you want to anything that's like hyper like that, the thuya, like the thuya and the silica could help with that as far as homeopathics go. But I wouldn't start it till after you've done the week of Nux vomica and phosphorus and make sure that all of her stitches are healed. Because if her stitches aren't healed, even they would have put absorbable ones in. Um, then sometimes the silica can try and force them out thinking it's a foreign body. Good boy. That was a big jump. Good boy. And so I wouldn't do the rebalancer. Make sure until all the stitches are healed. But that rebalancer, using that rebalancer like once a week for a very long time, like once a week for maybe a year even, is going to could potentially really help that. And then lots of like turkey tail, chaga, uh, phytoplankton. Those would be the three things that I would be looking at because when the gingiva is very reactive like that, because that's what it is, it's reactive. You also want to make sure that the liver is functioning. So make sure that you're doing liver tonic for a while. And but you definitely want to have the gut biome stronger. So because everything that's coming up, like all of the biome in the mouth is very closely related to the biome in the gut and sort of vice versa. So I would put her on probably Phytophthora to start because of the detoxifying effect of the fulvic and humic acid. Because when you have that much dental stuff going on, that bacteria showers on their heart valve, they're swallowing that bacteria. The fulvic and humic acid will really help to sort of detoxify her from that. So get her on Phytophthora, Phytosynergy, liver tonic. Let's do turkey tail first for sure. And then the rebalancer would be really good. And to heal her, she's 6 years old, spayed female Boston. If you went and got jump for joints and gave her jump for joints twice a day for maybe 2 to 3 weeks, that'd be very, very, very helpful for where you said there's bone loss because the symphytum, the knit bone, would really, really help for that. Does
That's
that make sense? I hope so.
interesting. Yeah. Kimberly is asking here, do you think using antibiotics when breeding cats is effective in preventing pyometra? Don't know if I'm
Pyometra.
saying it correctly.
Do
It
you
seems
think
very
using
common.
do you think using antibiotics when breeding cats is effective in preventing pyometra?
What is Pyometra?
I sure wouldn't do that, but um, pyometra is when the uterus becomes infected. Now, you know, I don't know. I don't know. I would have to almost say that there's something wrong if cats that are being bred and having kittens are getting pyometra, then to me something is off, you know. Usually, I mean, Pyometra is for me, I would rather you get a hold of like Andrea Ring or a vet that does homeopathy and do prophylactic homeopathic remedies, you know, to try and make sure that the uterus is completely void of pus. And the thing is that the body really shouldn't be thinking that it's pregnant again, because that's kind of what happens. And then it closes, the uterus closes to protect the babies as if it's pregnant. And then that's a closed pyometra. Can get open ones too, but that's sort of like the initiating causes all this hormone stuff. So by giving antibiotics, you're not you're not addressing the reason they're getting pyometra. You're addressing a prophylactic, you're trying to prevent prophylactically a bacteria that's not even there. And my big concern would be that you're going to have a cat or catsa that are in a very weakened state when they have kittens, because by prophylactically using antibiotics, so you're completely destroying their immune system. So the kittens are going to be born with a really bad immune system, and an immune system that's going to be more sensitive to autoimmune diseases and allergies and things like that. So no, I personally wouldn't do that. I would go and see a vet or work with a homeopath and use some prophylactic, if that's a concern, use some prophylactic homeopathics. And also there's different, you could reach out to Rita Hogan and ask her about prophylactic herbs even to tonify the uterus and things like that.
Kimberly is saying here in the chat that it's so very common with breeders. I am against it, but I'm so frustrated. And I never had used meds before while breeding, and what homeopathy remedies you were mentioning. And we had open Pyometra, treated it, then breeders telling me to use meds while breeding now.
I sure wouldn't. Like, I think, I don't know. I mean, this question could go on. Are you doing artificial insemination? Are you actually breeding with the cat? Are they actually doing like live breeding? Um, stress can cause pyometras, like it being just very unnatural breedings can cause pyometras. There's a lot of things that can cause pyometras. I mean, if this was a cat or a line of cats that I had, I mean, I would be digging into like why is it happening? Like really digging into why it's happening. Oh man, Caitlin, I know you're on there, and so is Tracy, so is I think Emily's there too.
Emily's here
Who's
too.
the wonderful, wonderful cat? We just love her. Cat vet. Oh my God. Guys, help me. Are they saying
Oh,
anything?
yeah, Jen Hove. I was with her name also.
What is it
Jen
again?
Hove?
Yes, Jean Hoff or
Hoff.
Hovey, I think her name is. She's amazing. She's wonderful.
Keelan saying that she's retired. Sorry to interrupt you.
What? But retired practicing, or does she still do online stuff? You don't know?
I don't know.
Hmm.
Let's see what Kaylin says. I guess
I
Kimberly already used like the antibiotics. So what she can do to support her cat now?
oh, then Felix Flora for sure because it's the only cat probiotic in the world that has feline species probiotics. So that's what I would be doing is giving her that right away.
Every day because she's already giving it.
She's already giving it? Well, then if she's already giving it, she's doing something already,
Yeah.
right? And but yeah, I would reach out to Jean. I would reach out to we have a lot of Tracy. Maybe she could say where she is, and Tracy's really close to a lot of the vets that we recommend. Maybe Tracy could recommend a vet that she could speak to Andrea. She could speak to Andrea about like remedies, like prophylactic remedies.
Okay. Just to finalize this, she's in Ontario.
In Ontario, okay.
So thank you, Julie. Thank you, Kimberly. Beverly Golden is asking here, good Wednesday. What protocol would you recommend before and after neutering a 5-year-old mainly outdoor cat?
Um, Mainly outdoor cat. So I would definitely recommend, um, arnica, phosphorus, and stephysagria, all in 200 C potencies. Maybe is Emily typing any of this in? Usually she types stuff in. Um, I don't know if she is or
She
not.
can.
Uh,
She can.
She can. Okay. So yeah, arnica, staphysagria, and phosphorus, 200 C. I would give that. You can, mix it up in or even, even for now, if you can get our go-to, you can use that instead and just mix it in their food. I would do that for a good week to 2 weeks after. But you know what I'd really, really do is I would again contact Andrea Ring and she could send you the feline spay and neuter protocol. And what that is it's actually there's a female spay and then there's a male neuter cat remedies. And the neuter one, the cat neuter one, is actually made from um, feline testicles. So, and it's a homeopathic, and what that does because usually it's when they're young, like really young, this happens. But sometimes just neutering them can make their urethra shrink, right? It can atrophy their urethra and then they'll get blocked easier. So putting them on that protocol is really very, very helpful. And a good raw food diet, just good food, good raw food. If he's outside, then he's probably hunting, which is good. But I would definitely do the homeopathics to make sure that, inflammation and it heals well. I guess the nice thing about our go-to is that it's got aconite in it, so fear. But staphysagria is something that for a 5-year-old that I would definitely recommend a homeopathic staphysagria.
Thanks, Julie. Sharing Garcia is asking here, hi Julie, thanks so much for being here tonight and sharing your time and knowledge with us. I truly appreciate you, appreciate all you do for us pet parents. Thank you,
Oh,
sharing. Our dog's cardiologist called last night. The 6-month Holter monitor results came in last week, and his heart is beating abnormally slow, ranging only 30-40 beats per minute more often than other range rates that it should be beating at. The cardiologist performed a test today to test the heart rate, some type of adrenaline injection. She said it shows that it's not the heart that is the issue, that there may be something else, such as cancer, tumors. She doesn't know. Well, where is in his body that is telling his heart to slow down? If it's not his heart that is causing the slow beating issue, what are some other factors that could be causing this heart rate to be so slow? And how could we address this more naturally, homeopathically? Since his rate is so slow, she wants to put him on hyoscyamine sulfate. What are your thoughts on this medication, and is there a more homeopathic route instead?
Yeah, well, I'm sure your vet has checked for thyroid. That's the first thing that I would be thinking of, thyroid or Addison's disease. Those would be the two things that I would be looking at. Deficiencies, like a mineral deficiency. So if they haven't done a full thyroid panel, like, and I mean a full thyroid panel, like that they sent to Jean Dodds. I don't know if you're in the States or not, but I would send a full thyroid panel to Homeopet, it's called, Dr. Jean Dodds. I would do that. I would do a mineral panel to make sure that that there's not something missing, like even oh my, that just went brain dead. Oh my God. Like iodine and things like that. I would do a full mineral panel on your dog. I'd also talk to them about I would also talk to them about Addison's disease, or like I said, hypothyroid. Those would be the things I would be looking at. And you could call Andrea Ring. She is taking a few more patients now. She was like full for a while. But you might still have to wait. If it's dangerously low, I don't know where you are. Maybe please put if you can, maybe Tracy, can you find out where Sharon is, and then maybe we can recommend a vet that she can go see that is more holistically oriented. Garcia, to everyone, we are in CT. Okay, so Tracy, maybe you could send her to a more holistic vet. That would be great too. But in the meantime, you know, uh, things that are really good for the heart, I would be putting your dog on potency right away, whether it's a tumor, whether it doesn't matter, it's still affecting the heart. So I would be doing potency, I would be doing turkey tail, and I would be doing phytosynergy with your dog, and probably the wolf probiotic, and I would be doing it ASAP.
Amazing, thank you. An anonymous question here. Could you please discuss some situations where it is possible versus impossible or less likely to rebuild muscle in middle-aged dogs with arthritis once lost? If possible, please provide recommendations to help rebuild the muscle.
So I mean, a big part of why they're losing muscle is because they're not able to engage the muscle because of the arthritis. So I've seen this tons of times. So tons of times with horses, tons of times with dogs, even cats. So the first thing you want to do is address the arthritis. Um, Lots of things to do that. Like our jump for joints, I think, is one of the best things to do that. When you do that, depends on where the arthritis is, you can help to rebuild muscle in like swimming, right? Swimming is a really good way to rebuild muscle because there's no weight on the joints, so that there's not as much pain. And protein. So middle age, people go, oh, too much protein because they're older or whatever. But quality protein, lots of quality protein, like really easy to digest proteins. would be something that I would be also really looking at. And I don't know how much muscle loss the dog has. And, is it losing muscle for sure because of this arthritis, or is it also losing muscle because of some other chronic, chronic metabolic disease of some kind? So, full blood work always helps. I love doing blood work. It gives us lots and lots and lots of information. I would consider doing some blood work. Put your pup on really good quality raw food. And you could start off by taking it to swim classes. So until the arthritis, you can get the arthritis under control. And a really good way of doing that is jump for joints and no sugars um and again, potency or omega-3s are really, really important. Amino acids are really important. That's in phytosynergy. But yes, I've seen lots of middle-aged animals with arthritis treated the right way be able to rebuild muscle. Osteopathy is amazing because they manipulate the muscle and the bone and the tendons and everything. So they manipulate kind of everything. Like I said before, that Kayla light therapy, crazy, crazy good for arthritis and healing because the light produces collagen. That's the other thing is collagen is really good for rebuilding muscle. Um, but this light therapy is excellent.
Thanks, Julie. Pita is asking here, or my cat is unfortunately taking fluoxetine temporarily after trying many other things for spraying issues. He's having some urine retention issues with this. What do you suggest I give him for supplements? Lots of cat questions today. That's
Hmm. That's unfortunate. I wonder why he's spraying. I'm so upset that Jean's is because she's amazing. Like for stuff even like this, like from a um, you know, emotional standpoint. So urine retention, I mean, Peter, I don't have to say how dangerous that is because it's very dangerous. So what I would do is I would put your cat on liver tonic, first of all, to help with the side effects of that drug. And then I would definitely put him on the easy peasy protocol. So, sometimes when animals have spraying issues and you've tried everything, I don't know what everything is, but often it is pain. There's a pain or a boredom or an emotional component to it, like a big emotional component to it. So, Felix Flora getting a good probiotic in his body so that it's like the gut brain connection if there is some kind of issue with emotional stuff right now. Liver tonic, just try and support the kidneys and the liver with this, and then definitely the uh easy peasy protocol and really good food, like I don't know whether your cat's on raw food, but if he's not on raw food, I would definitely recommend either raw food or freeze-dried, re-soaked freeze-dried food or canned food. But if he's on, I'm saying he because female cats can spray. That's more often in males, but um, uh, you know, dry food can be a real culprit to spraying and to retaining urine.
the spraying because of territorial issues from outside cats.
Ah, the outside cats are bugging him.
He had
Okay.
lightly home cooked and high quality canned, no dry food.
Okay, great. So the other thing I would do is I would get our go-to, and I would put so you really have for cats, you really have to, I don't know if your cat drinks water, but if he does drink water, I would put uh, one pump of go-to in a cup of water, and then fill up your cat's water bowl, and then put like a couple teaspoons or tablespoons of that of the water that you've mixed already in the water into his water bowl every single solitary day, and every single time you change it, because that can help deal with like the stress aspect of the cats. That's very helpful. And then the other remedies that are could be helpful, and you could phone Andrea, but is a remedy called gnat, mure, or ignasia. I would tend to think potentially ignasia if he's spraying. Um, that really sucks. That's awful when other cats come around and torment indoor cats. It's crappy. Uh, I don't know if you've tried getting a friend cat, because maybe sometimes that helps to get a partner cat. Just helps to take the focus off the cats outside, because then now there's another cat inside. So that can help also.
The cat doesn't drink water, and there is a girl cat too. She is very easygoing.
Okay, so it doesn't drink water. That's fine then. So just take a one pump and put it in. I don't know how often you feed it, but put one pump in a glass of water, and then take a very small amount, like, half a teaspoon or a teaspoon, and mix it into his canned food. There won't be any taste to it, so just don't make it too watery. But put it in his canned food.
Okay, thanks, Julie. Angela is asking, hi, my pit bull has cancer on the Linux. That's the way it says. Linux.
Maybe she means the larynx.
I'm looking for the best homemade snacks for him and the best raw diet.
Hmm. Well, soft. I mean, that's the first thing
Thyroid cancer, sorry.
oh, thyroid.
Yeah.
Hmm. Well, anything to do with like even in that area. So, I often say to people, make sure that they're not using pinch collars, make sure that they're not even using collars, that there's, especially for anything thyroid related, right? Like if they put, and especially if they pull. So, I would be saying, definitely soft treats, like don't not anything hard, because if the thyroid is enlarged at all, which often it is, but if it's enlarged at all, it'll already be pushing on the trachea. And when they swallow, if it's crunchy, or it pushes, it can cause them to cough. And then when they cough, that creates more inflammation, right? Like secondary inflammation. So snacks that don't have sugar in them, you know, cooked chicken that you chop up and you keep in the fridge if your dog's not allergic to chicken, or all different kinds of cooked meat that you could just chop up and leave in the fridge. Lightly steamed vegetables, so that again the cellulose is broken down, so that it's not so crunchy when they're swallowing it. And raw food, I'm not sure where you live. There's lots of good raw food diets out there. But probably the best thing is put in where you live, and then maybe we could refer you to a pet store. But first thing that I'm looking at is, I don't know whether you're on any one of our products. So I would say Phytosynergy and for thyroid. Phytosynergy for sure, and probably chaga, those two in combination. And definitely a really good probiotic. But this time, what I would say probiotic wise, I would actually say gut soothe, because when, again, anything that's around the throat, you want to make sure that the trachea, the larynx, anything is maintains its integrity from a perspective of it not becoming overinflamed and creating more mucus, because then that's just going to cause her to cough. So, putting a harness on her so that nothing's pushing near her thyroid. I would use gut soothe as far as a probiotic goes, because that will help. The N-acetylglucosamine will help to decrease the inflammation in those in that lining, and phytosynergy, and definitely chaga tincture, the mushrooms. And keep your eye out for some stuff that we're launching in January, or maybe we're talking about cancer in January what? When's the cancer lecture?
8.
January 8th.
Yes.
So, you guys can, anybody that's dealing with cancer or afraid of cancer or knows the high ratio of cancer with dogs right now is crazy. I am doing a lecture on some research that I've been doing at Dalhousie University on January 8th. So if you want to make sure that you're part of that, that'd be awesome.
Do we still have time for one or two more
Yeah.
questions?
Yeah.
Okay.
And
So
you know what? We'll do that one, and we'll do the immune-mediated polyarthritis one, because I have um lots of
to say.
suggestions.
Okay. So Robin is asking here, season's greetings, Mariana and Julie. Thank you. My 8-year-old GSD has
German Shepherd.
a suspected upper GI bleed. I'm reluctant to agree to an endoscopy because of the general anesthesia. She is taking Yunnan bio,
Bio.
5 days on, 5 days off. Any suggestions? Thank you.
Oh my gosh. Yes, tons. Oh my God. Tons and tons. It's okay, Henry. Well, I would suggest an upper GI bleed. I would definitely suggest gut soothe for sure. Um, and I would suggest, really digging in. If you're giving those TCM herbs, then you're probably talking to either a vet or someone that knows TCM stuff. So I would ask them about a cooling diet, something specifically to cool the body down. And then maybe Emily, you can write this out, write this. Uh, there's, again, if you want to put Andrea Ring's uh, email in there, she would be great to talk to about this. But you could get our right away till you can get to a store. You could get the go-to, and put some go-to in some goat milk, raw goat milk or something, and do that maybe 2 to 3 times a day. That will be really helpful. And the other thing too would be phytosynergy would be really good, because when there's an upper GI bleed, the possibility of her really digesting her food properly can also be questionable. So the great thing about phytosynergy is it doesn't have to be digested, and she'll get all the benefits from that as well. But homeopathic, if you can get, I don't know if you're in the US or in Canada, but there's like homeopathy overnight. You can go to a health food store. But I would get phosphorus, and I would get a 30C phosphorus. I would also get a remedy called Hydrastis. And I would get 30C Hydrastis. And then you'll have the arnica and the aconite. And I would give all three of those uh 2 or 3, no, 3 times a day for a while. Now, you should try and make sure that your I suspected upper GI, but so whatever her symptoms are that they suspect it, I don't know where they are. Maybe Marianne, if they could quickly fly that question into the chat or something, like what is she doing that they think that she has an upper GI bleed? And then, making sure that you're keeping notes. Is her energy, like usually if it's a bleed, is her energy better? I don't know whether she's gulping. I don't stretching. I don't know what she's doing. But, watch and see with these remedies and the gut soothe and the phytosynergy, see if that starts to slowly decrease. And then you'll know you're definitely on the right track.
She's saying that she's in Canada. The symptom is anemia and otherwise asymptomatic and no gulping.
Okay, good. So anemia. So I don't mean good, but that's something that you can watch, right? That's something that you can monitor pretty easy. They don't have to do like full blood work. You can just take her in and have her check to see if the anemia is getting better. But the phosphorus and the arnica and the hydrastis homeopathic and the go-to, that should really help if that's what it is. Help support along with making sure that she's on, nice cooling foods.
It's also saying that it's been difficult to keep weight on.
Hmm. Yeah, well, that makes sense. That's another reason that phytosynergy would be good and gut soothe, right?
Yeah. Okay.
What
So
are you
the
doing?
question from Lori here, immune-mediated polyarthritis.
Polyarthritis.
Is there a best immune modulator for it? Thorn, Modulator, standard process, immunoplex, now plant sterols. And thank you. My vet has him on 20 milligrams daily now and immunoplex by standard process. How do I know if it's working? I want him off steroids. He also has IBD. Let me see if there is any, because it seems to be a second part of it, but I couldn't find. Lori, if you're still here, he's also, she's saying here, I want him off steroids. He also has IBD and he's also a parvo survivor.
Oh, that makes sense. Okay, so a couple things.
Oh, just
All right.
before you start, sorry. He has had 4 surgeries for bowel obstruction.
Oh, wow. So he's probably also got a lot of scarring and potentially um, uh, like fibrotic stuff going on there. And maybe some adhesions, I wouldn't doubt that he's got adhesions as well. So first of all, I would be doing from a perspective of modulation, Thorn and Standard Process are both really good companies. So, take your um take your choice on Immunoplex. I don't know, the Standard Pro Immune now plant sterols. Yeah, they're all good. They're all really good products. Where I go with immune modulation is in the gut. So, you know, knowing, a lot of our probiotics, that's exactly what we check for to see if there's an immune modulating aspect to it. So with this pup, I would give definitely especially with IBD, I would be giving this dog gut soothe for sure. And the wolf. I would be just putting both of those probiotics in immediately. The gut soothe has done amazing things for IBD. They've also researched phytoplankton with inflammatory bowel disease because if this dog has had that many surgeries, we can probably guarantee that he's got scarring. And where there's scarring, there is no or very, very lessened bioavailability in those areas. So that in itself could be stimulating the immune mediated polyarthritis. It can be, I'm sure that this puppy probably has leaky gut, I would imagine. You could put him on the leaky gut protocol, but I wouldn't do the enzyme right now. So maybe instead, what would be better is, and I don't know if someone wants to write this down for her or whatever, but I would do Gut Soothe, Liver Tonic, the Wolf, Phytosynergy, and definitely your go-to. Why I was saying the leaky gut, we don't normally do this, but the gut seal, the homeopathic gut seal would be helpful as well. So from an immune modulation perspective, all of those probiotics are immune modulating, and so is turkey tail and chaga, but really turkey tail. So I would be looking at starting him on turkey tail as well. And then one last thing quickly is there's lots of homeopathic remedies for IBD, like phosphorus is an incredible one, arsenicum is an incredible one. But immune modulated polyarthritis, a remedy called, if you can write this down, phosphoric acid. So if you were to put your go-to and phosphoric acid, get a 200C phosphoric acid. If you were to do that just routinely 3 times a day, like if he's symptomatic right now, you could actually do it 4 times a day until his symptoms start to get better. And you can definitely be doing all of these homeopathics with the steroids, right? You don't have to worry about using homeopathic medicine with steroids. But just be careful because the steroids are suppressing his immune system. So you don't want to really be giving anything that, as you probably know already, that's gonna, heighten the immune system. And you don't have to worry about that with homeopathy. Homeopathy is so safe that way. But I've worked with tons, including my own dog, immune-mediated polyarthritis, and it is definitely workable. I would work probably with Andrea Ring and a really good holistic vet because, and that's the other thing, liver tonic will really, really help. If he's probably on Pred or something, I don't know, but a steroid. That's why I would, make sure that he's on liver tonic as well. But Lori, there's tons you can do. Like things are just going off in my head right now. Like I would be working on the scarring and the adhesions in his gut. If he's got adhesions or even the scarring, can trigger some pain that can make the IBD worse. The IBD and the pain can trigger immune-mediated polyarthritis. This can become a very, very like a vicious circle if you don't get with the right vet and the right support system. But getting with the right vet, having the support that you need, either like I would suggest a really good vet, and Andre Ring. That's what I would do, and then the products that I recommended. You can turn this around. You really can. I mean, I can't guarantee it for sure because I don't know your dog and everything, but I've seen tons and tons of cases that have done really well. But this is a multitude of problems that your dog has. So, but they're all connected, which is a good thing because if you can address them all, then they should all start to dissipate. And then you should be able to manage it. Like you can't get rid of all the scarring. You probably couldn't get rid of all of the adhesions if they have them. But I've seen dogs completely heal from immune-mediated polyarthritis and inflammatory bowel disease. So, stay hopeful. Just, make sure that you have the right team working with you.
Just a few things from Lori. She said that he's on our gut soothe and gut heal rotate. They saved his life. And
Say that
also,
again. Say that again.
so she said here, he's in our gut soothe and gut heal rotate. They saved his life. And but she's also asking here, pretty please, can someone write down so take him off the gut heal enzymes?
Oh, she's on gut. Oh, healthy gut? Healthy gut is the enzyme. Is he on healthy gut or gut seal?
Yeah, it's confusing now. I'm confused too. Yes, healthy gut and gut soothe.
Well, if he's on gut suit or healthy gut and it's not aggravating his IBD, then I wouldn't worry about it. I definitely wouldn't worry about it. It's got larch in it, which is an immune modulation. So, don't worry about that. But sometimes gut soothe or healthy gut can digest the food so quickly, like really fast, that sometimes it's just too much. It's too intense for IBD dogs. Whereas gut soothe is kind of the opposite. It really helps. But saying that, this is why I keep going to like adhesions and scarring potentially. Um, if there's a lot of adhesions and scarring, then healthy gut can be a lifesaver because it helps the body to digest it so it can be more bioavailable and allow the nutrients to be absorbed. So from his food. But yeah, I mean, if it's already on it and he's doing okay, then I would just do everything else that I like contact a really good, maybe, where did you say she was from? Did she say where she was from?
Don't, I don't know. I don't think so. Let me.
Okay, well, if she can maybe quickly put that in the chat and then maybe again,
A
Tracy can.
Western and C. I think I may switch it and get the rest of your recommendation. Western NC. I don't know NC. Where is?
Okay, well,
North Carolina. I don't know.
maybe. And what didn't she get? She didn't
From
get the
hurricanes.
recommendations. She didn't get the recommendations? Is that what you just said?
No, I think I may switch it and get the rest of your recommendation.
Oh, okay. Okay. All right. And then maybe Tracy, if you know anyone in that area, any vets in that area that you could recommend to her.
Kaylin's saying, isn't Dr. Judy in North Carolina?
Is she?
I
I
think
don't
so.
know.
Elaine is saying that Dr. Judy is in Zebulon. I don't know. Sorry if I'm saying it wrong. North Carolina, yes.
Okay, well, she's amazing. I mean, if you can get in to see her, then go see her
Oh,
for
Gian
sure.
is saying that she's not taking clients.
Right. Okay, well, there's got to be someone else in North Carolina. Maybe if she's not taking them, does she recommend anybody else? And again, I mean, if you get a hold of Andrea, she can't, decrease your pred, but she can help you with everything else, remedy wise and stuff. And then hopefully your vet will work with her and slowly reduce his pred. Yeah, definitely don't just stop his pred, my God. Don't do that. Make sure that you've got a whole bunch of stuff on board and then start to reduce the pred once the remedies and everything else are on board. Like that would be ideal.
Amazing. Okay, guys, I guess this is it for tonight. I know that
Oh my God, there's
um,
a lot.
Yeah, we still have a lot of questions here, but it's very late for us, and I know that Julie still have a lot of things to do tonight. So I have to wrap up the webinar. And I can understand how frustrated it can be to not have your answer at question answered. So please, if you didn't get your question answered today, join our community on Facebook, the Dorbeast Collective. You can post your question there and we will be glad to help you. Um, I want to thank everyone who joined us today, and of course you, Julie, for your time and knowledge. Don't know if you want to say some final words for us.
Well, it's Christmas coming up and holiday season's coming up. So, happy holidays. I hope everybody has an amazing time, that all your fur babies are safe and healthy. If they're not, then, don't lose hope and, also reach out. The collective is there to support not just healthy dogs, right? But support dogs and cats that are struggling and the pet parents that struggle with them. So, life's not always totally rosy. And sometimes Christmas makes it even harder, right? Christmas and holidays makes it harder when you have a dog. How many dogs do we see with cancer, right? Today, So, um, yeah, just hang in there, reach out to us if we can help you. We definitely will. Thank you all so much for supporting Adored Beast and me and Mariana, and thank you to all the love and support that you always give us. And for those of you that don't know, but I think that y'all do, the support that you give ABA goes directly to the farm sanctuary here. Um, and so lots of horses and cows and blind potbelly pigs and cats and are going to have an amazing year, they are having an amazing year. I've been lucky. But lots of carrots and apples and squashes and pumpkin seeds and sometimes a little bit of on Christmas Eve, uh, Guinness beer. And yeah, so
Julie,
they all they all say thank you to each and every one of you for supporting them as well.
thanks, and I wish you all a great night. And don't forget to subscribe to our newsletter. You can sign up on our website to get all the information about Outdoor Bees, our promos, new blog postings, future Ask Julie and future Ask Julie Anything sessions. Thank you all again. It was a pleasure to host these webinars, and having you as an audience made them even more special. I'm happy that we were able to help so many of you and your fur families during 2024. Once again, thank you for supporting us and stay tuned. 2025 will be a year full of good news and new launches at ABA. Have a great night, and I wish you all happy holidays. See you next
Bye,
year.
everybody. Thank you.
Bye.